Joining me now is Senator Ossoff of Georgia. He chairs the Senate Subcommittee on Human Rights. He was down in Atlanta just this morning, where he held the committee's second field hearing to directly hear from women and doctors on the impacts of Georgia's 6-week abortion ban. He's also married to an OBGYN, who I'm sure impacts your thinking as well. So I want to start, Senator. I mean, the story I just told from ProPublica is shocking. It's upsetting. I had a hard time getting through it. It's not an anomaly. And you were in Georgia this morning. You've had these field hearings. You hear the stories. You're hearing the stories from these women who were experiencing the impacts of a 6-week abortion ban. What did you hear from some of these women this morning?
Jen, good to see you. Thank you for having me. And in this series of hearings, we've heard directly from OBGYN doctors and from women whose pregnancies have been impacted by our state's extreme 6-week abortion ban. It's worth setting the scene. Before Donald Trump overturned Roe v. Wade and Governor Brian Kemp imposed this abortion ban, Georgia already had one of the highest maternal mortality rates in the country, and half of our counties lacked any OBGYN at all. There's an underlying maternal mortality crisis in Georgia. What we've heard from OBGYNs in these hearings is that, first of all, OBGYNs are deterred from training and practicing in Georgia by the threat of criminal prosecution, worsening our state's OBGYN shortage. Second of all, this law is putting women's lives at risk. It is delaying their access to care during complications, during high-risk pregnancies, and during miscarriages. And today we heard from 2 women who had high-risk or non-viable pregnancies, but were forced to continue those pregnancies or to leave the state to get care because their doctors feared prosecution.
It is so horrible to hear. And some of these standard forms of treatment, when there are bans, women don't have access to them. You raised the impact on doctors, and this is such an important part of it. And I did want to play some of this video from your hearing today, and we'll talk about it on the other side of one of the doctors.
Physicians, myself included, have seen patients in the ICU with sepsis, with renal failure, needing tube feeds, with hemorrhage, needing blood transfusions or a hysterectomy, who would not have been in those positions if we had been able to offer them care to avoid further harm.
I mean, you were taught, I'm not a doctor, but you were taught as a doctor to heal, to do no harm. These doctors are not able to do what they were taught to do in medical school. Talk to me a little bit about, you've mentioned it a little bit, but the impacts on kind of the medical profession and OBGYNs across Georgia who are trying to save women's lives and are unable to do it because of the law.
One OBGYN told the subcommittee a story. She was a young doctor, born and raised in Georgia, had wanted to practice in Georgia, but because of the threat of criminal prosecution for doing her job, had decided not to train or to practice in Georgia. Remember, we already have an underlying shortage of OBGYNs. So instead, she was practicing in Massachusetts. Well, a pregnant woman from Georgia who was having severe complications had to leave Georgia to get care. On the way, lost her pregnancy, wound up in this doctor's exam room in Massachusetts with sepsis, a life-threatening blood infection, because she'd been unable to get the care she needed in Georgia. So what we're clearly hearing from doctors and from women who have experienced pregnancy under Georgia's abortion ban is this having a severe impact on maternal health, and it's resulting in denied or delayed and potentially life-threatening denials and delays of care to women with high-risk pregnancies.
It is horrifying to hear. These stories they just stick with you. One of the things that we were talking about briefly before we started this conversation was just, it's not a secret what an abortion ban would be like across the country. I mean, a 6-week abortion ban is essentially, a lot of women don't even know they're pregnant by then. And so when Donald Trump and J.D. Vance say, just leave it back to the states, Georgia, you know what it's like in Georgia. This is what it could be like across the country. I want to just play something Senator Vance said about the possibility of a national abortion ban and talk a little bit about what people should know. You're living it. You're talking to these women who are experiencing it.
So he would veto a federal abortion ban?
I think he would. He said that explicitly, that he would.
J.D. Vance has said that you would veto it if it did come to your desk.
Well, I didn't discuss it with J.D.
So would he veto it?
Kristen, I think that I've learned my lesson on speaking for the president before he and I have actually talked about an issue.
wanted to play that because it's often this talking point is we can punt it back to the states, and I think he would veto an abortion ban. But there's huge real-world consequences here. What do you want people to know who use this talking point? Just send it back to the states. The states can decide. It will be fine.
Look, it's now been 2 years since Donald Trump overturned Roe. Brian Kemp banned abortion in Georgia at 6 weeks. We now have had the time to see the effect of these laws. And by listening to OBGYN doctors, by listening to women whose pregnancies and health have been impacted and threatened by these laws, we can see the devastating impact this is having on women in Georgia. Georgia women, no matter their political affiliation, do not want or need Donald Trump, Brian Kemp, J.D. Vance managing their high-risk pregnancies, managing their miscarriages. Doctors in Georgia fear criminal prosecution because of this law. That means women are not getting the health care they need. And we heard today in Georgia that women are being forced to continue with high-risk and non-viable pregnancies as a result.
The subcommittee is doing such important work in elevating the faces and voices of these stories that really make it clear to people what's happening. You know, I told Amber Thurman's story a few minutes ago, and the Georgia committee reviewed deaths through fall of 2022. So there's a lot of time that has happened since then. Is there anything the subcommittee can do or other legislative tools that can happen to have a better accounting for deaths that are resulting from abortion bans and from the impact of Roe being overturned in Georgia or other states across the country?
Well, the reason I'm holding these hearings is to give doctors and patients the platform to testify to what they've experienced. We're going to continue to hear from more and more doctors and women who have been impacted. The bottom line is that a 6-week abortion ban, which takes effect before many women even know they are pregnant, is having a dire negative impact on the quality of health care available to pregnant women in Georgia. We're hearing that through these personal stories, and we're seeing that through the data.
Senator, it was great talking to you. Thank you for holding these hearings. I understand you're going to do more. You're going to elevate more stories, potentially so important for people to hear. Really appreciate you bringing it to us.
Thanks for the opportunity. Take care.
Still